Cobalamin is a water-soluble vitamin that's plentiful in most commercial pet foods. Cobalamin is tightly bound to dietary protein. The dietary protein is digested in the stomach by pepsin and HCl. Cobalamin is released but is immediately bound by a carrier protein, which is called the R protein, which is synthesized and secreted by the gastric mucosa. The R protein, in turn, is then being digested by pancreatic proteases in the small intestine. Cobalamin once again is being released, but immediately is bound by yet another carrier protein, the so-called intrinsic factor. Only complexes of cobalamin and intrinsic factor can be absorbed by specific receptors that are located in the ileum only. In dogs and cats with distal small intestinal disease involving the ileum, the receptors that absorb cobalamin intrinsic factor complexes can get destroyed. Initially, this is of little consequence since the ileum has a lot of such receptors. However, if the disease process is severe enough cobalamin receptors are being destroyed that cobalamin malabsorption ensues. Initially, this is again of little consequence as there's large body stores of cobalamin. Only when these body stores are being used up will serum cobalamin concentration slowly decrease, leading to cobalamin deficiency. The exocrine pancreas plays a central role in cobalamin absorption. Thus, many dogs and cats with exocrine pancreas insufficiency will develop cobalamin deficiency. This is due to several reasons. Most importantly, cobalamin can only be absorbed in the ileum when complexed to intrinsic factor. This molecule is believed to be mostly secreted by the exocrine pancreas in both dogs and cats. In addition to this, the pancreas also releases pancreatic proteases that are responsible for digesting the R protein, which binds to cobalamin in the stomach. However, it is believed that the lack of intrinsic factor is more important than the lack of pancreatic proteases in the development in cobalamin deficiency in dogs and cats with exocrine pancreatic insufficiency.